Hello, I'm Gabby McGrath, an anaesthetic trainee from University Hospital Sussex, and I'm presenting a service evaluation project on recovery after emergency laparotomy conducted at Worthing Hospital. Emergency laparotomy and laparoscopy for non-traumatic conditions affect over 28,000 patients annually in England and Wales. Since the inception of NELA in 2013, there have been demonstrable improvements in many aspects of patient care, but in-hospital mortality and length of stay have plateaued. A focus of our work was Dreaming, a simple care bundle encouraging early drinking, eating and mobilising, and widely used in elective surgery enhanced recovery pathways. In elective care, evidence shows dreaming is associated with shorter hospital stays and fewer complications, but its role in emergency surgery is less clear. There are well-defined best practice guidelines for pre and peri-op care in emergency laparotomy, but much less focus on the post-op phase. Our project aimed to explore how feasible it is to deliver early rehab, such as dreaming, in this group, and to understand barriers to doing so. This was a single-centre service evaluation project using NELA inclusion criteria to identify patients. We followed up patients on days 1, 3 and 7 post-op to investigate dreaming rates and used the Johns Hopkins highest level of mobility scale. We also surveyed the multidisciplinary team to identify perceived barriers. Data was collected on 30 consecutive patients. Most patients were drinking within the first 24 hours post-op. Only one patient was eating a soft diet, which increased to 14 by day 3. Also on day 3, 28% of patients were still bedbound, and 43% of mobile patients required assistance. Barriers to mobilisation included pain, a lack of structured rehab assessment, limited patient engagement, and physical tethering from lines and monitoring equipment. Nausea and vomiting was the biggest barrier to eating and drinking, followed by unclear post-surgical instructions and limited food choice. MDT members suggested that clearer guidance would help deliver dreaming. We were able to show that it is practical to collect dreaming data in emergency laparotomy patients. In the future, this could provide valuable information to develop and deliver early intensive rehab in this cohort, similar to other patient populations, such as patients who have sustained a fractured neck of femur. This project has been used as a pilot for a multi-centre cohort study, which received a grant from the NIAA to assess quality of life measures of patients undergoing emergency laparotomy and laparoscopy, and monitoring the trajectory of recovery, including dreaming data. Thank you for your time.